While hormone replacement therapy may be something that's good for you or you may be a candidate for it, there's actually some people that actually should not be taking it at all. So my name's Dr. Gabrielle Francis and welcome to my series Empowered Menopause. On this episode we're going to discuss HRT and who's a candidate for it and who actually shouldn't be using it at all. So let's go. Before you determine if you are going to do HRT, you have to work with your doctor to kind of see if you're actually a candidate. There's some people who really shouldn't be using hormone replacement therapy. If you're a breast cancer survivor and you have estrogen or progesterone receptor positive cancer, you should not be taking HRT. If you have a family history of somebody with breast cancer, fibroids, cysts, even some people with endometriosis, you may not be a candidate. You have to ask your doctor about that. You also have to be monitored yearly to make sure that you're getting a mammogram, a breast ultrasound, and a pelvic ultrasound to make sure there's no breast cancer, fibroids, cysts, endometriosis, or ovarian cancer. And the reason you have to be monitored yearly is because bioidentical hormones don't cause cancer, but they can feed cancer if you have it. So it's very important to kind of get monitored and make sure you're cleared by your medical doctor before you go on the HRT journey.